The shoulder joint. Learning outcomes. Students should be able to 1. Describe the type, articular surfaces, fibrous capsule, synovial membrane, ligaments, important relations, movements, arterial and nerve supply of the shoulder joint. 2. Discuss the factors contributing to the stability of the shoulder joint. Shoulder or glenohumeral joint. Articular surfaces. 1. Head of humerus and 2. Glenoid cavity of scapula. Type. Morphologically. Ball and socket synovial joint. Functionally. Multiaxial joint which allows movements around 3 axes. The shoulder joint has a wide range of movements due to 1. Large convex humeral head. 2. Shallow concave glenoid cavity. 3. Lax capsule. The fibrous capsule. Attachments. Medially to the glenoid margin. Outside the labrum glenoidale and above the supraglenoid tubercle. Note that, the labrum glenoidale and the tendon of origin of long head of the biceps brachii are intracapsular. Laterally to anatomical neck of humerus, but inferomedially it descends on the surgical neck for 1 to 2 centimeters. This means that the medial aspect of the surgical neck is intracapsular. Perforations of the capsule are 3. 1. Anterior perforation for communication with subscapular bursa. 2. Posterior perforation for infraspinatus bursa, may be absent. 3. Lateral perforation for exit of the tendon of long head of biceps and its synovial sheath. Attachments of the fibrous capsule again. Medially to the glenoid margin. And laterally to anatomical neck of humerus. But inferomedially it descends on the surgical neck for 1 to 2 centimeters. Notice perforations of the capsule and its lax part inferomedially. Shoulder joint in X-ray. Synovial membrane. It lines the inner aspect of the fibrous capsule. It covers the intracapsular structures except the articular surfaces. It forms a tubular sheath for the tendon of long head of biceps. Shoulder joint has 3 supporting or accessory ligaments. 1. Coracohumeral ligament. It extends from the root of coracoid process to the greater tuberosity of the humerus. It supports the superior aspect of the capsule. 2. Glenohumeral ligaments. They are arranged as superior, middle and inferior ligaments. They extend from anterior margin of glenoid cavity to lesser tuberosity. To support the front of the capsule. 3. Transverse humeral ligament. It extends between the greater and lesser tuberosities, bridging over the tendon of long head of biceps in the bicipital groove to keep it in position. Shoulder joint has 3 intracapsular structures. 1. Labrum glenoidal, a fibrocartilaginous ring attached to the margin of glenoid cavity to deepen it. 2. Long head of biceps. 3. Synovial membrane. Shoulder joint is related to 3 bursae, outside the capsule. 1. Subscapular bursa, anteriorly, communicates with joint cavity. 2. Infraspinatus bursa, posteriorly, may communicate with joint cavity. 3. Subacromial, subdeltoid, bursa, superiorly. It lies between the tendon of supraspinatus and coracoacromial arch, extending deep to the deltoid between it and the lateral part of the capsule. It doesn't communicate with joint cavity. Relations of shoulder joint. 1. Anteriorly, subscapularis. 2. Posteriorly, infraspinatus and teres minor. 3. Superiorly, supraspinatus, subacromial bursa and coracoacromial arch. 4. Inferiorly least supported side, long head of triceps, axillary nerve and posterior circumflex humeral vessels. Stability of shoulder joint, 5 factors. 1. Rotator cuff. This includes muscles inserted in the lesser and greater tuberosities, subscapularis, supraspinatus, infraspinatus and teres minor. Their tendons fuse with the capsule all around, except below, and they are the most important supporting factor of the shoulder joint. 2. Coracoacromial arch. 2 processes and a ligament, prevents upward displacement of the humeral head. 3. Long head of biceps, supports the humeral head from above. 4. Long head of triceps, supports the humeral head from below, during abduction, only factor in abduction. 5. Labrum glenoidale deepens the glenoid cavity. Again, factors for stability of shoulder joint. 5 factors. Rotator cuff. Coracoacromial arch. Long head of biceps from above. Long head of triceps from below only factor in abduction. And labrum glenoidale. Note that dislocation of the shoulder joint occurs commonly downwards at the least supported side. This may lead to injury of the axillary nerve which runs below the capsule close to the surgical neck of the humerus. Arterial blood supply, 3. Suprascapular artery. Anterior circumflex humeral artery. And posterior circumflex humeral artery. Nerve supply, also 3. Suprascapular nerve. Lateral pectoral nerve. And axillary nerve. Movements of shoulder joint. Are 7 movements. 1. Flexion, is done by muscles anterior to the joint. Pectoralis major, clavicular head, coracobrachialis and anterior fibers of deltoid. 2. Extension, is done by muscles posterior to the joint. Latissimus dorsi, teres major, posterior fibers of deltoid and pectoralis major, sternocostal head. 3. Abduction, by muscles superior to the joint. The movement is initiated by supraspinatus, 0 to 15 degree, and completed by middle fibers of deltoid up to 90 degree. 4. Adduction, is done by the 3 muscles inserted in the bicipital groove. Pectoralis major, latissimus dorsi and teres major. In addition to subscapularis. 5. Medial rotation, by muscles which are inserted in the bicipital groove. Pectoralis major, latissimus dorsi and teres major. In addition to anterior fibers of deltoid and subscapularis. 6. Lateral rotation, by muscles inserted in the posterior surface of greater tuberosity. Infraspinatus and teres minor in addition to posterior fibers of deltoid. 7. Circumduction. Flexion then abduction, extension, and adduction. Movements of abduction of the arm above the head. Range or degree of movement. Joint concerned. And muscles producing the movement. Key facts. All muscles connecting the thoracic cage to upper limb, 4 muscles of pectoral region, act on shoulder girdle except pectoralis major, on shoulder joint. All muscles connecting the vertebral column to upper limb. 5 muscles of the back, act on shoulder girdle except latissimus dorsi, on shoulder joint. Pectoralis major and latissimus dorsi are called the climbing muscles and act on shoulder joint. All scapular muscles, 6, act on shoulder joint. Dear students, answer the following quiz. Question 1. Which one of the following muscles acts on the shoulder girdle? Deltoid. Latissimus dorsi. Pectoralis minor. Supraspinatus. None of the above. Correct answer is C. Pectoralis minor. Question 2. A 34-year-old woman came to the outpatient clinic complaining of inferior dislocation of her left shoulder following an accident. She was unable to abduct her arm to 90 degree. Which of the following nerves is mostly injured in this case? Axillary. Median. Musculocutaneous. Radial. Ulnar. Correct answer is number A, axillary nerve. Question 3. Enumerate factors responsible for stability of shoulder joint. Dear students, my best wishes. Hany Waheeb.